Hi, I'm Dave Heath with the Retail Association of Maine. This series of videos on reopening retail under COVID-19 is intended to provide you with best practices for resuming retail business activities safely during this pandemic. These recommendations are based on guidance from the Maine Department of Economic and Community Development in consultation with the Maine CDC and in compliance with executive orders from the Governor. Putting these practices and recommendations into place will help ensure the safety of customers and employees alike, so please pay careful attention. More information and details are available at maine.gov/DECD. We're so happy to have you back and to be restarting retail activity in Maine. The more consistently everyone follows these guidelines, the stronger our reopening and our retail businesses will be. Every business is a little different, and while these general practices apply in some way to all businesses, you may find the need to adapt these recommendations to your specific situation. Personal hygiene is at the core of safety measures under the current pandemic. Virus particles adhere quickly and easily to skin, fabric, and especially moisture and water droplets. Because of this, two of the most important things you can do to prevent spread of the virus are covering your face and washing your hands. Breathing and speaking cause droplets of moisture to project into the air in front of you. The more forcefully you speak, the further those droplets may carry. And coughing or sneezing can expel droplets for several yards. Because active virus can be present even when individuals do not experience symptoms of sickness, state guidelines are requiring all individuals to wear cloth facial coverings when out in public. In order to be effective in blocking moisture from breathing and speaking, the covering must fit snugly and securely over both your mouth and your nose. Leaving either exposed will allow significant chance for transmission of droplets. The covering should be secure enough that it does not slip and require adjustment by hand. Touching the mask to adjust it can contaminate it if virus is present. There are a couple of ways to secure your facial covering. Many have a flexible metal nose bridge sewn into the hem. This allows the mask to conform to the contours of the nose without a gap. You can also use medical tape, available at many pharmacies, to secure the mask to the face and cover gaps. This also helps to avoid fogging if you wear glasses. Make sure the elastics hold the mask in place securely without pulling on your ears. If they aren't long enough, you can connect them behind your head by sewing a cloth or elastic band, or even just a piece of twine or string. If your employer doesn't provide you with a cloth facial covering and you choose one of your own, make sure it will be secure and comfortable for the duration of your working shift. Again, you don't want to have to be adjusting it by hand frequently. The second major component of personal hygiene during this pandemic is frequent hand washing. Hand washing is one of the best ways to protect yourself and those around you from transmitting germs and disease. It's particularly important to wash hands in between contact with customers, other employees, or people in the workplace, and after touching items that may have been handled by others, such as tools, pens, keys, credit cards, cash and coins, POS terminals and cash registers, reach poles, barcode scanners. Washing with soap and water thoroughly for at least 20 seconds is the best way to ensure clean hands. If you can't practically wash thoroughly between customer interactions, a hand sanitizer that contains at least 60% alcohol can be an acceptable substitute in a pinch. If you're working with food items, hand sanitizer is not an acceptable substitute. Be very careful not to touch your face, especially if you've not washed thoroughly. Virus particles on your hands can infect you by entering the body. The nose, the mouth, and the eyes are easy points of entry for infection. Guard them carefully by keeping your hands clean and away from your face. The final point on personal hygiene is this: get in the habit of monitoring your own health regularly. Keep on the lookout for symptoms of COVID-19, the disease caused by the novel coronavirus. Some of these symptoms include fever, cough, shortness of breath, chills, muscle pain, sore throat, loss of taste or smell, nausea, vomiting, diarrhea. Checking your temperature before your work shift is a good way to help avoid spreading the virus. If you have an elevated temperature or any other symptoms related to COVID-19, contact your healthcare provider and let your employer know you are exhibiting symptoms. You should not go to work if you're sick. These videos are resources. Official guidance is available from the state at the Maine DECD website. Information is changing rapidly, so pay attention to updates related to COVID-19. By putting these recommendations into practice, we're building habits that will pay off in a safer, stronger, more robust retail community for the future. Thanks for watching, and thanks for working in retail in Maine.